Welcome to Learning from Indigenous Leaders, Climate Change and Public Health, a video series where we hear from various speakers regarding the effect of climate change on health, why it's important, and what both public health practitioners and the public can do to improve health in the face of climate change. This series was produced by the National Collaborating Center for Infectious Diseases, or the NCCID. The NCCID is hosted at the University of Manitoba, situated on the ancestral lands of the Anishinaabeg, Anishinaabeg, Dakota Oyate, Dene Sulene, and Naheithawak/Ininwak nations. It is also in the heart of the homeland of the Métis Nation. At NCCID, we strive to honor the lands and their original caretakers in our work. We acknowledge that we are on Treaty 1 land. We recognize that this and other treaties have not been implemented in good faith, as a part of an ongoing process of colonization that benefits some of us and harms others. We are committed to working with our partners towards reconciliation. In this video, we'll hear from Andrew Arreak, so let's get to know them and the work that they do.
Hi, my name is Andrew Arreak. I'm the Nunavut Operations Lead for Smart Ice, and I work from home, my community in Pond Inlet, Nunavut. After graduating high school, I attended Arctic College, a program called Environmental Technology Program. After finishing that program, my colleagues and we got together in our community and we started asking ourselves what we should do to help out the community. And we've been seeing a lot of researchers from the South coming up, and it hasn't really hired local people rather than being a polar bear monitor or cook or guide. None of it being actual hands-on experience and learning what research is being done. And the community got concerned about that, and because it was repeating so many times. What my ETP colleagues came up with is what we call the Ikavik, where we meet and list community concerns regarding research. And sea ice was on one of the top lists because we use it in our everyday lives. And majority of our year, we have ice, sea ice. But with climate warming up, I think that will change dramatically and we'll have less sea ice time to go out, enjoy the land, enjoy what the land has to offer. The sea ice was asked to be monitored. It all started from a conference call with Trevor Bell. He had an idea of how to monitor the sea ice in real time. So it started off as a pilot project here in Pond Inlet and in Nain, Labrador. And since then, it's been going on. And other communities heard about it, and they too wanted our service. And from there, Smart Ice has been growing ever since.
Why is climate change important to you?
Yeah, changing of the climate is crucial for us. We are aware of it happening because we are seeing some changes each year. What I do with Smart Ice is we monitor the sea ice because we use it in our everyday lives. We use it to go to our camping grounds, hunting grounds, and even to travel to another community. It's like our highway. And the ice is forming a little later each year and breaking off a little earlier each year. And what Smart Ice is able to provide is real-time sea ice conditions while being out on the ice for the community.
How does climate change affect infectious disease in public health?
Well, with the warming of the climate change, there'll be more species that will be emerging up in the north. Not only species, but also some diseases, I guess. About the invasive species part, I'm concerned about because that will have an effect on our sea mammals and our animals that are already living in the Arctic.
How does climate change affect Indigenous communities?
Climate change is affecting us in many different ways. When I said earlier, when the ice is coming and going earlier each year, we love to be out on the ice. It's therapeutic for us. It gives us a chance to think and to get away from the community, or to get away from technology. And I think it's important to our important for us mentally to be out on the land, because I think it's important for us to be at where our ancestors were and be grateful for what the land has to offer.
What can everyone respectfully learn from Indigenous knowledges on this topic?
Simply by having community meetings and talking with elders, because elders, I think, they have a lot of knowledge and they've been around the area for a while and they know what's best. So researchers in the past would arrive to the community and do their research in or around the community and hardly give any feedback to the community. And they were doing this for their own personal gain, for their own personal benefit. When you go to a community, you can't be in the community and work on what you want. I think it will be more beneficial for both parties to meet and discuss and have community priorities, so both parties can work together, incorporate traditional and modern knowledge.
Thank you for listening. All videos, infographics, and resources from the Learning from Indigenous Leaders Climate Change in Public Health series are available on the NCCID website.